Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes, and I'm just going to discuss about bit of letter because now the last time the letter came was a visit or discharge letter. So this time again after that obviously it is expected that it would come either discharge back or referred back letter to the GP. That is mostly expected, and in New Zealand that would be otherwise. In New Zealand now discharge letter or visit letter will come, whereas in India, so this is what is majorly expected, because in the recent times I have seen that in New Zealand and India exam is coming differently. Maybe they are checking it, which is a good thing. So they want everybody to pass by their caliber, not by asking each other. And anyhow, nobody can help you by even telling you question paper. Nobody can help you. So it's better that different countries are having different exams. So this is what we are expecting now as per the Indian standards, or from Dubai standards and all. So suppose this is the letter. Suppose this is one of the letters we are doing today. Eventide retirement home. Patient Patient's physical address is this. So patient has come to our hospital due to fall at this home. Now he is better. So he is going back to the same home. Eventide. So the patient is coming from the same place, came to us. He is better now. He is going back to retirement home. So I want to make it simple. The first paragraph, this letter is being written regarding your resident, because we are writing to these people only. So he is your resident. So this letter is being written regarding your resident who was admitted to our hospital due to whatever the reason would be, due to falling, due to high blood pressure, whatever would be given, due to AURTI, acute upper respiratory tract infection, due to acute manic episode, whatever the problem would be, whatever. You will write the problem here, main problem. So you will say the patient came with this and this reason. So now, simple. Now, after treatment, he is better. So he is being discharged back to the retirement home. So this the word is basically an article that says back to your retirement home. So who was admitted? This letter is being written regarding your resident who was admitted to our hospital due to this. Now after treatment, so he's being discharged back to the retirement home. Once he reaches there, you are advised to follow few instructions for his speedy recovery. If the only change that you have to use your mind according to the exam. So if there is some change, like suppose if he had a fracture, due to fracture, so you can put it over here, due to fracture. After now after treatment, after treatment ki jagah you can say after applying plaster cast and physiotherapy, what that would be given. You don't have to create by yourself, but I'm saying try to use it. So after applying plaster cast and having physiotherapy, basically this having is going with after having physiotherapy. So after applying plaster cast and having physiotherapy, he is better. So he is being discharged back to the retirement home. Once he reaches there, you are requested to provide him ongoing physiotherapy, and please note that his plaster cast, yeah, please note he needs to be presented passive voice. He needs to be presented again after 5 days for the removal of plaster cast. That is how sensible you can make it. So I'm not saying that you have to write exactly the same what I have written, but you can make a sense. See, I changed no pattern, no grammar, all the grammar is same, all the grammar is same, all the grammar is same, but it's just I followed the pattern, but I made it little easier for the examiner. So he came with the fracture after having, suppose if he came with the acute manic episode. So he came with the acute manic episode. After required medications, after treatment, along with counseling sessions, that would be given. Obviously, that would be given. You don't have to write anything from counseling. His main words after treatment, including counseling sessions. Sorry, it is also part. If you don't want to write it, not a problem. You don't have to mandatory write it. I'm just saying you can make it better. Now after treatment is better. Otherwise, including counseling sessions. he is better, so he's being discharged. Once he reaches there, you are advised to take care of him and to monitor him. Yeah, main in this kind of a letter, main thing would be to monitor his condition and to inform us promptly means quickly, promptly. This is also good word for reading, promptly, for any abnormality, for any abnormal behavior. So that would be given if there is something like this given. So again, if you do, even if it is given, you do not write this line, does not make a difference. You need to monitor his condition. That's it. Even then it's fine. So means you want to make sense to your first paragraph. So this letter is being. So during hospitalization, you can say during hospitalization, or you can say at the time of admission. At the time of admission, as he was having manic episode, so this was given. So जो भी आपने किया, so whatever you did. So this is how simple it is. So this would be given. So this treatment was given. So at the time of admission, as he was having as and so will always be in combo. As he was having this, so he was given this. Now the rest of the treatment. Along with that, now it's a simple letter. Along with that, he was given this, he was given that. Then you say after discharge. So you can make, if it is big, the treatment is big, you can make 2 paragraphs of treatment. Otherwise, discharge ki you will have 2 paragraphs. After discharge, after reaching to the retirement home, now you will explain the points. It would be after reaching, it is important for the patient. So don't always start with it would be greatly appreciated. So we'll say it is important to provide him this, to provide him that. So this is the discharge plan. So that is how simple letter you can make it. First paragraph, main things, purpose of the letter. And if you want to know the purpose is this, that he is being discharged back and he needs monitoring. This is the purpose. This is the main purpose. If you will, this is the simplest way of writing the letter. Otherwise, even if you write now, this letter is being written regarding your resident. And simply if you say, who is being discharged back to your retirement home, who is discharged back to the retirement home and needs monitoring. Even then the purpose is clear, to be honest, if you want to. But this I feel is little complex. Though you will say there are less words, but in this grammatical chances are more. So that grammatical error chances are more. That is why I do not support these kind of pattern. Otherwise, this is also this letter is being written regarding your resident, Mr. X, who is being discharged back to the retirement home after getting required treatment. Once then that is where again best method comes. Once he reaches there, you are advised to provide him, you are advised to monitor his condition. Again, that is why I'm saying this is the best method. If you keep on explaining, it will become better and better, but don't write it over. So now the old method comes, is who was admitted. So I would like to tell why was he admitted. So he was admitted due to acute pain. Now the topic is clear. That is why I always say this pattern is easier. That is, whenever you will see our YouTube, people will say, oh, this is a very easy pattern. That is why, because I'm telling why the person is coming, what did we do, and he's better. That is why he's being discharged back. And now, once he reaches there, you are advised to monitor. So that completes the thing, and that makes it easier for you and easier for the reader as well. That is why you get 350 rather than 300. That is why I support this pattern, because otherwise also the purpose is clear. The way I said that, if you just kind of uh, you know make this thing disappear. But this is not the best pattern, because you want to tell what happened to the patient. because obviously they know, because the patient came from the same place, obviously they know, but still it's much better this way. He was admitted to our hospital due to acute, so that the retirement home can relate to the patient. Now after treatment including counseling sessions he is better, अब वो better हो गया है, so he is being discharged back to the retire. तो जिसको एडमिट किया गया था, पैसिव वॉइस वॉज एडमिटेड, जिसको एडमिट किया गया था हमारे द्वारा वॉज के साथ थर्ड फॉर्म, नाउ वो बेटर हो गया, इसलिए हम डिस्चार्ज कर रहे हैं आपके रिटायरमेंट होम में। अब इसकी जरूरत नहीं है क्योंकि हमने रिक्वायर्ड ट्रीटमेंट वाइल लाइन लिख दी है। सो ही इज बीइंग डिस्चार्ज, वंस ही रीचेस देयर यू आर एडवाइज्ड टू मॉनिटर हिज कंडीशन सो एज टू सी एनी एबनॉर्मल बिहेवियर। मतलब कुछ भी लिख सकते हो आप अपनी लैंग्वेज में जैसे मर्जी, बट ग्रामर को ठीक रखो, राइट इट इन योर ओन लैंग्वेज, कीप द ग्रामर नाइस। So this is what can come, or even if it comes to a referred back letter to a GP in the exam. Suppose if this letter comes as a referred back letter, there are no changes. I will copy paste the same. See, I will copy paste the same. Suppose GP, the resident went to GP. The resident went to GP. Let me frame it for you. One more condition. Let me make it little complex letter for you. Suppose there is a complex letter that comes in exam and it is not complex, it would be easy as well. Look at this. Resident, he went to GP. GP suspected him with a fracture. This kind of a letter can come. Okay, this would make the letter complex. So they want to give you little complex letters, so they would be giving you something like this. So there are many frames: resident, GP, then hospital. GP resident had a fall. He went to GP. GP says suspected fracture. He sends the patient to hospital. We are the hospital. After treatment, we discharge the patient. Simple. Again, please, आराम से listen to it lightly. We discharge back the patient. We discharge the patient and tell the GP to follow the precautions, to provide the follow-up care. And also we need to tell the GP, and also we say the GP that give this information to resident home as well, retirement home as well, sorry, retirement home as well. So now this letter is the most complex letter that can come, but to be honest it is not complex if you understand the situation. So let me not take help of this, otherwise you will get confused. So now suppose if I have to frame such a big letter, resident, resident means retirement home. At the retirement home he had a fall. Suppose he went to GP. GP said it is a suspected fracture. Then GP sends the patient to hospital. We are discharging back the patient to GP. Discharging back to the GP. Follow-up care, give this information to the retirement home. So now, see. It would be again simple, same grammar, nothing. Please write it lightly. This letter is being written regarding your referred patient. Regarding one of the patients, one of your referred patients. अच्छा लगेगा. So I'm telling the GP that this letter I'm writing regarding one of your referred patients, Mr. X, who was suspected with fracture. So now GP would be able to relate, yes, I sent a patient, I was suspecting with it fracture, his name was this. So he would be able to relate. This letter is being written, one of your referred patient who was suspected with fracture. After X-ray, he was diagnosed with fracture. Connector for which plaster cast was applied. Again, go with the flow. Aram se plaster cast was applied. Now, again, same. Now same things. Now he is better. Same pattern is being followed. That he came to as a suspected case. After X-ray by us, he was diagnosed with fracture. for which plaster cast was applied by us again. Now he is better. So he is being discharged. Now please understand, I will not call it discharged back because he is not going to retirement home. He is going to GP. So please understand, in this case, I will not say discharged back. So that is why I'm saying referred back. He is being discharged and is being referred back to you for follow-up services. This is the only difference. Please try and understand that discharge back word is used when he is going to the same premises. But we are referring back this patient. That is why it is known as referred back. We are being referred back to you for follow-up here. That's it. If you have to write this message, retirement home message, this we will do in the last. Please convey the message to the retirement home as well about follow-up care. So GP will do. So it depends upon letter. Means I am not the only thing, if you can understand, that I did not make it complex anyway. This letter is being written regarding one of your referred patients, Mr. X. I did not mention about this thing. I made it simple. I am talking to GP. So I will say, I remember a patient who was suspected with fracture. If you want to write who was suspected with fracture at the time of admission, but that makes it complex. Why to write it? After X-ray, he was diagnosed with fracture, for which plaster was applied, or you can say plaster cast was applied and required treatment was given. If you want to write it, up to you. Again, these lines will not make any difference. Now he is better, so he is being discharged and is being referred back to you for follow-up. So please listen to this video 2-3 times. You will learn a lot of things from this small and simple video, and this we can expect to come as well, and is a very simple letter. Please never make it complex. Don't think about retirement home too much. Always think about to whom you are writing the letter. Suppose if this letter would have been just last thing, if suppose if this patient was not going to GP, rather the patient is going to retirement home, and we have to write the letter to retirement home. So I will make this letter is being written regarding your resident. See how simple I will make it. Please, your resident, Mr. X, who was referred to us by his GP. So I will tell the retirement home due to suspected fracture. So now I have made it simple. Now I'm writing to the retirement home that this letter is being written to your resident who was referred to us by his GP due to suspected fracture. After X-ray, he was diagnosed with fracture. After X-ray, fracture was confirmed. Yeah, with X-ray. Yeah. After X-ray, after X-ray, his fracture was confirmed. So basically, I want to relate it due to suspected fracture. After X-ray, his fracture was confirmed, for which plaster cast was applied and required treatment was given. Now he is better, so he is being discharged to the retirement home. Now this is not a discharge back letter, and neither this is one. So I won't write discharge back myself because patient did not come to me from this center. Patient came to me via GP. So I'm saying he is your resident. He is being discharged back to your retirement home. You are advised to follow few instructions for his PD. Once he reaches there, then I will say it. So I will remember the lines. I'm telling you to remember the lines, to learn them, but you have to change them according to the situation. Once he reaches there, You are advised to follow two instructions for his video call. For his video call. So that is what I want. He try to change few things. So go and follow the grammar. And again, that is why I always say, please listen all our videos till the end. This is Dr. Bhupesh from Dr. BKM Institute. Our contact number is 769673426. Feel free to call us for the best OET coaching. And now I'm going to put it on mute and will ask my students that if they would have any doubt. Thank you so much. And I'm just going to stop the recording and we'll take your doubts now. Thank you so much for your patient hearing. I know it was tough, but then you have the recording as well. Listen to it 2-3 times and you will become master of writing and speaking. I have recorded 2 things today. Thank you so much.